and out.
Oh my goodness. I'm a nurse, so there's a lot of boosting people and helping them get up in the morning. So it's just a lot of weight. Even like, you know, they always tell you lift through your legs and stuff like that. I'm like, these people weigh 3 times
You
as
move them
much
however
as
you
I
gotta
do.
move them, right?
Yeah. Or if they're falling, I'm like, I'm catching your head before you hit the ground. That's
We're
all
going
I
down
do.
together.
So I definitely feel like the muscles in my back and my actual spine take a lot of that. Other than that, I'm like, I'm okay. It's like,
Okay.
Yeah.
Yeah, let me check out the back a little bit here. Any pain down here? You said you feel it kind of in between the shoulder blades here?
Yeah.
Okay. Definitely be able to get some movement through there.
I've been in physical therapy because I managed to mess up my shoulder while working, and she's like, yeah, your posture kind of sucks.
So we're here to work on, right?
Yeah, she says I hunch, like I move everything forward.
Yours isn't bad though. I mean, yours is very minimal, so you're actually doing pretty good.
Perfect.
All right, so yeah, I'm gonna take you through a full body adjustment. I'm gonna work neck, mid-back, we'll kind of work full spine. We're gonna start with the neck first here. This is the magic hug if you've seen this one. Did you watch the videos at all? Kind of get a heads up?
I would say I did not. It's gonna be a surprise.
Okay, cool. We'll get some authentic reactions. So we're gonna start right here. There's gonna be C1, C2. Just nice and relaxed, a little pressure here. Good release there. Let's see how this right side feels. Same thing, just let this fall. Nice and relaxed for me. A little tighter on this side. Oh.
It's so satisfying to hear.
That was a good release. Very good. Press your elbow back into me. There we go. Press back here. Good. Those are nice little baby pops there.
Yeah, I was like, that was so much easier than I thought it was about to be.
It's like concrete through here. A little pressure. Good. Let's do a couple more here. Good. One more. Good. Yeah. That's pretty tight. Some good movement through there though. The elbows together for me in front. Nice and tight. Little pressure. There we go. Good. I know. That was a really good one.
Yeah.
See how this is. Okay. A little tight here. Pressure. That was a crispy one. Good. That one was better than the other side. That was really good. The decompression, you're going to feel this go down the back.
Okay.
You're going to feel the vertebra open up and decompress. And just stay nice and relaxed for me, okay? We're going to take a breath in and out.
Oh my goodness.
There we go. So that's most people's favorite.
Yeah.
How far down the back did you feel it?
I was saying, I felt it like down to your...
Perfect. That's what we're looking for.
How awesome.
Yeah.
I feel like I'm going to be so relaxed today. It's
You're going to be a little bit taller too.
Yeah, absolutely.
All right. Yeah, maybe right here. Good.
Oh my goodness.
These are really good. Nice. Not getting that one. There we go. That's a cool ring.
Thank you.
Nice. Pretty good.
All the crunches. My mom was like, are they sure they want to hear all that?
What do you, as a chiropractor, that's like what we love, right?
You're like, this is the most satisfying thing ever.
The crunchies are fun.
Yeah, no, my mom if she hears anything pop, she starts gagging. So
Okay.
she was like, they want to hear that?
It's like,
"Yeah,
we'll have
probably."
patients that come in that love to get adjusted, and then the spouse will be like, they hate the cracks.
Yeah.
Or we've had people that are like, I have to leave the room.
Yeah.
Either they can't even sit in here. So.
Yeah, no, she's that way. Where even if I like pop my fingers in the room, she's like, I have to go. I'm like, well, she had to get adjusted before. She's a nurse as well. And they cracked her neck, and she's like, that's it? I'm paralyzed. You can still move, Mom.
She was stressing.
Yeah, she was terrified.
How do you feel?
A lot better.
Good?
A lot more
Yeah,
calm.
that was perfect. Great adjustment. Everything felt good. Super crunchy.
Awesome. Thank you so much.
Yeah, of course. What type of things give you trouble?
Nothing really.
Everything feels okay?
Yeah, I feel like
If you had to pick something, you feel perfect all the time.
My knee a little bit, like when I walk, kind of. Maybe the back too.
And then you got mad at me earlier because I called you a bartender.
Yeah.
But you're not a bartender. Okay.
Cocktail waitress.
Tell me a little bit about what your day-to-day is like.
I see a lot of people. I talk to a lot of people, so it can be a lot and overwhelming, but when, at the end of the day, like, it's all worth it.
Yeah. It's a very rewarding job.
Yes,
Okay.
Yeah.
It took like a solid 2 months to get you to come in for the appointment though, I think.
I know.
We've been working, this has been a work in progress for a while.
I canceled. It's because I'm scared.
You canceled?
Yes, remember I called, I think I told you I was sick.
She's admitting she lied to me.
I told you I messaged you and I said, I'm not gonna lie.
You can go ahead.
Sorry.
Yeah. What were you saying?
Scared.
I'm not doing anything yet.
I was like, I'm not gonna lie, you know, I'm scared, and I think I kind of hinted that I lied.
Yeah, so you're so nervous about the first appointment, you're like, I can't come in.
Yeah.
But now,
and then
we're here now at least.
yes, and then yeah.
I think today's the day, yeah. All right, so we're gonna start with the neck here.
Okay.
Start on this side. She's really scared of the cracks, so we'll see how it goes. Just drop this head down for me. Good, nice and relaxed.
Oh my god.
Okay.
Do I move fat? Like, is it okay to move?
You can move. It's okay.
Ooh, wow.
How we doing?
Do you ever think your job's like wild?
All right.
It's very surreal.
You did way better with that than I thought you were gonna do.
Yeah, I mean, I thought I was gonna pass out.
That'd be viral content for sure.
You're like, you can do that if you want.
Yeah. Same thing here. All right.
I see like some spots after.
Feeling a little lightheaded?
No, I think I'm fine.
All right, let's hands on your hips for me.
Like that?
Yeah, a little bit harder. There we go.
It's a little one.
There's a little baby pop. Same thing here, press back. A little bit harder. All right, we got to get you to hit the gym. Let's go on your stomach for
Call
me.
me fat.
Whoa, no. No.
I'm kidding.
I was saying you weren't strong enough. Don't twist my words. Let's go on your stomach for me. Just like that.
Oh my god.
Nice.
Wow.
She's gonna become a crack addict for sure.
Oh.
Nice. Really good one there. So low back here, you can just stay nice and relaxed.
Oh.
There we go. Then we can flip to the other side. How are we doing so far?
Yeah, it doesn't feel like how I thought it would.
Yeah. You thought it was gonna hurt
Yeah.
or be uncomfortable?
Yeah.
I think she likes it. And get this side here.
Ooh.
Even bigger on that side.
We're getting through it.
You're making it. Did you see the towel decompression? You see that one?
I don't know.
Okay. So you've done great with everything else, so I think you're gonna do good with it.
Okay.
So lift your head up for me and back down. Good.
Okay.
All right.
This one was the scariest one, I think.
You got it. You got this. All right. So for this one, just stay nice and relaxed.
Okay.
Take a breath in. Let it out.
Oh. Oh my gosh.
What do you think?
Yeah. Feels nice.
You did it.
Yeah, I did. Is that it?
For that part, yeah.
Okay.
We're gonna keep going. I'm just giving you a second.
Okay. Yeah.
Usually people need a minute after that to just breathe through it, you know?
Yeah. Okay.
Feeling okay?
Yeah. That one I think felt the weirdest.
How far down did you feel that?
I want to say like right here.
Okay. All right, we're gonna check the neck one more time.
Ooh.
A little bit more.
Wow.
Trying to stay relaxed. There we go. You feel those?
Yes, I did.
I can't get a good read on you right now.
Really?
You can go ahead and sit up.
Can you read all your patients?
What's that?
Can you read all your patients?
I feel like I usually have a pretty good read on if they liked it or not, yeah.
I'm like kind of shocked.
Yeah. How do you feel? How was
Good.
everything?
Yeah, it was really good.
Not as bad as what you expected, right?
Definitely not.
Did you have one that was your favorite or stuck out to you?
I didn't think that I would like the head pull, like
Uh-huh.
the spine one, but I think that one was my favorite.
That was your favorite? Okay. Tell me all about it. What's giving you trouble?
Like I said before, I always have neck pain, always have lower back pain and hip pain. Here recently, like I've had a lot of knee problems, and that's just from like me bartending and standing all day and running around. But yeah.
And where were you deployed to?
I was deployed in Texas, down at the border, doing the border mission.
Gotcha. So lots of back pain from, you said you were carrying some heavy equipment?
Yeah, we had real heavy vests on. We had those big old heavy helmets. Sat in Border Patrol vehicles all day, so that's not really the best thing to be sitting in all day because you're slouched over. You're just trying to be comfortable all day, and then you get up and you walk around, and the ground's real hard, so that's not very good for standing on all day.
Yeah. You get hot?
I think I sweat out majority of my body weight almost every day.
Yeah.
And that was probably the most water I've ever drank in my life. I'm terrible about drinking water.
Good adjustment today, right?
Yep.
All right. Sounds good. Well, yeah, let's go ahead and get started.
Okay.
Go ahead and scoot forward just a little bit for me. You're actually in a perfect spot. You sat right in the exactly where you should, so.
Just like all time.
Right? Back at it. So it's long overdue. You think you'll be pretty crunchy today, or
I think
what's your
so.
prediction?
Well, I was sleeping on my boyfriend's dorm twin-size bed, so I should be pretty crunchy.
No, thank you. That sounds horrible.
Oh, it's awful. Oh.
Yeah, dorm life can be rough. All right, let's try this side. That left side did feel pretty tight. Just drop your head down. Nice and relaxed. Nice. All right.
That was nice.
Hands behind your head for me. Interlace your fingers. Great. And then we're going to bring your elbows together.
Oh my god. See, I remember that one wasn't as big last time.
That's
Now
probably
it
the
is.
biggest seated thoracic I've ever gotten.
Oh.
That was massive. Good. Press your elbow back. Easy. Very nice. Press back here. A little bit more. Okay, let's try one more thing. Just relax this arm for me. We're gonna chicken wing it here. Okay.
I do have double jointed shoulders, so.
So shoulders are really tricky sometimes.
Yeah.
They don't always cooperate. So we got one though. I'm happy. with
Last
that.
time both of them did it. But
Really?
I don't know.
We'll try to come back to it at the end. We'll let the shoulder think
Loosen
about
up
it a
a
little bit.
little
Yeah. Oh, wow. She had more in there. I didn't even. Wow.
Like a glow stick.
No kidding. Super crunchy today. Okay, I think we finally got everything
Oh, that was nice.
out of the mid back. Sorry. This is the one you like the most?
Yes, it was so good.
This one's my favorite too.
Yeah.
It's like, I don't even know.
Everybody, I don't know. This one
It's
just
like-
hits different sometimes.
I sometimes I try to like do that in my bed, but
Yeah,
I'm
you
by
do.
myself.
You
Keep the leg
just-
over.
Yeah.
Nice and relaxed.
Oh!
Wow. I mean, you just have one of the loudest adjustments I've ever seen.
And see, like when I'm sitting in a chair and I just try to like pop my back like I normally do, here recently I haven't been able to do that. I've just been really stiff.
Well,
I've always wanted to do this one too.
there you go.
I'm like, I'll probably get a loud crack out of this one.
So, yeah, we're building up to it. Lift your head up for me. And back down. So, yeah, you just stay relaxed for me.
All right.
Breath in. Let it out.
Oh my God. I feel like I'm 2 inches taller.
How far down did you feel it?
I felt it all the way in my tailbone.
Sick.
That felt so good.
She's gonna be a noodle.
I am. I'm gonna be so relaxed. For
She's gonna be a craft noodle. These are kind of like fitting socks now that I think about it.
Oh my God.
Good. Okay. All done. How you doing?
Feels so good. I am so ready now for the 17-hour car ride.
Yeah.
I feel like I can go party for a week straight now.
My spine.
Yeah.
I have recently been x-rayed and it showed a curvature of the spine, which I wasn't expecting. I've also got supposedly arthritis in my neck, possibly in other places as well. I do a lot of lifting. I work in a warehouse. I'm on a concrete floor all day. So yeah, I want to see a chiropractor and maybe get some of these aches and pains worked out.
Have you ever seen a chiropractor in the past?
Yeah. As a matter of fact, I went to one in Webster Groves a year ago. You know, that guy, he had this table that he would put me on. It was electric. I'd stay, you know, like, and then he'd press a button and it would lean back. And then he would do something, I never saw what, but the table would go chunk, chunk, chunk. He never gave me what I would call a proper adjustment. He was never hands-on. I mean, I went to him 7 or 8 times and that was it. I'd had it with him.
Right, because you weren't getting a manual adjustment. You didn't feel like you were getting anything out of the treatment.
I wasn't getting anything out of it. So here I am to see what the heck happens.
Yeah. So you said you saw some of the videos online. What did you see in the videos?
Well, like I said, I guess you call it the decompression.
Yeah, that's my name for it.
And you standing on the table grabbing people's necks, and I mean I'm like, yeah, let's I gotta go see this guy.
You want somebody to rough you up a little bit?
Oh yeah, and it's gonna be right here, standing in the corner with the camera in hand.
All right, well, let me check out the back a little bit and we'll get rolling.
No tenderness.
Now you said you work in a warehouse and you lift heavy boxes, heavy containers.
The heaviest box I lift regularly is something like 54.6 pounds. However,
Exactly 54.6 pounds.
I know because I just weighed it yesterday.
So I'm noticing that lateral flexion in the neck here is pretty restricted. So we want to be able to get that ear over to the shoulder a little bit further. And then when we're going through the mid back there, feeling quite a bit of restriction and stiffness through there. So those are going to be the areas that I think could use the most attention. Who is that?
Oh, you don't know who Dr. Torquemada? You don't know who Torquemada is?
Is that a chiropractor on YouTube or something?
No. I strongly suggest you watch Mel Brooks's History of the World Part 1.
Okay.
Torquemada was the head Spanish inquisitor.
Oh no, I feel like this is going somewhere
Yeah,
bad.
historically, he gets compared, Hitler gets compared to him and he gets compared to Hitler.
All right. Okay.
Hurt me, Doc. If your chiropractor isn't hurting you, he's not doing you any good. Come see this guy. Agony guaranteed.
Oh man. All right.
I keep all my coworkers in stitches,
Entertained?
in stitches all day long. Don't ask me how.
I'm sure you do. All right. So let's go.
Okay.
We're gonna lean this head over here. Pretty restricted here. We're gonna go right here.
Oh yeah.
Never had anything like that before?
Nope. That's one move I've never experienced before.
What about the decompression?
Never experienced that before. Looking forward to it.
I love it.
Dr. Torquemada. You can't torque him out of anything.
Oh man. Well, my job's really fun. All right. We're gonna drop this down here.
Oh yeah.
Ooh. Are we in pain yet? Not yet? We're just warming up.
Oh well, yeah.
Let's go hands on your hips for me.
Hands.
Just like that. Press this elbow back into me.
Oh.
Same thing here, press back.
Oh.
One more time.
Oh, yeah. Yep. 4th, I'll be 58 years old.
Wow. All right, so mid back here,
Uh-huh.
nice and relaxed.
Oh, yeah.
There we go. Another one here.
Oh.
One more here.
Oh.
Wow. Did you feel that one too?
Oh. Doc, what you doing back there?
Face me on your side over here. Just like that.
You got it.
So low back here. There it is.
Okay. Other side?
Other side.
You think I'd remember this?
Same thing here.
Oh.
Nice. And we're gonna go flat on your back for him.
Here we are.
What do you think this is gonna feel like, Charles?
Wonderful!
Yeah?
I want to feel it all the way down my spine, just like everybody else says they do.
Uh-huh.
Yep.
So we gotta get a good one. The pressure's on right now.
Yeah, so let me ask you something.
Uh-huh.
I saw the x-rays of my spine a few weeks ago, and there was a definite curvature. Will doing this compression do anything to take out that curvature?
No.
Even just a little? No?
Old school chiropractic might say yes. Research in the last 20 years has shown we're not moving bones, but we're improving mobility in the joints. So as we loosen up the joints, as we loosen up the muscles, you may notice changes in your posture, absolutely. But as far as adjustment equals change in spinal curve, that's not exactly right. But you may notice you feel a lot better and you move a lot better is a more accurate way of describing it.
That's the important thing, really.
So with the decompression, just stay nice and relaxed for me. I don't need you to do anything. You're gonna feel this down the back. You'll feel all the vertebrae open up.
Oh, yeah.
Separate here. And we are ready to go. So breath in for me. Let it out.
Oh, yeah! That was magnificent. All the way down. Oh. I want to try something. Do I need to stay tied in here?
Oh, yeah. We can get you up.
I mean, do you need to leave me tied in before I do anything?
No.
No? Okay. I want to try something here. Oh, you get
Go for it.
I'm just wondering. I didn't try this before. Holy Moses. How far do you think I am from my toes? 4 or 5 inches?
Yeah, I'd say 4 or 5 inches.
I guarantee you, if I would have done that before you did all this, I wouldn't have gotten any further than that. Probably 8 to 10 inches.
So big improvement for what you're used to.
Oh yeah. I do feel a little of that residual pain up and down my spine, but I had an ache to the right of the spinal column near the right shoulder blade. That is completely gone.
Awesome.
I feel absolutely magnificent. Is there anything else you can do to me, Doc?
Yeah, there is. Lay on your back for me.
On my back. Oh, yeah.
So a little pull here.
Oh.
Good. Same thing here.
Oh.
There it is.
Yeah.
Now you can sit up.
Now I can sit up.
All right.
Am I good?
You're all good.
We're done?
Anything else you want to say to the camera? This is your time, so.
Thank you, Doc.
You're
He's
welcome.
the man.
Con l'altro indice, senti che c'è una differenza? Destro è lungo?
Sì.
Gira la testa a destra. Migliora ma non del tutto. Gira a sinistra. No, qui rimane proprio usare questa diagonale tua. Dritta col ginocchio e col gomito, spingi in su tutti e due. Ok. Dritta col ginocchio e col gomito, spingi in su. Perfetto, vediamo se c'è un problema. Fa male qua?
Meno.
Testa dritta?
Sì.
Un po' di più.
Sono storta.
Gira la testa a destra.
Mhm.
Meglio, eh?
Sì.
Vediamo come rispondono gli psoas. Spingi in su. No, non è bloccato, per fortuna. Spingi in su. No, va bene. Posso continuare a fare quello che avevo iniziato. Quindi sinistra in alto, rilassata. Morbida, morbida, morbida. porta il piede in su, spingilo esternamente contro la mia mano, vai. Peroniere, va bene. Vediamo quello lungo, spingi in
Faccio?
esterno. La stessa cosa, spingi esternamente, vai. Vai. Vediamo il confronto con questo, vai.
Quella è quella sana.
Sì, è un pochino di differenza c'è.
Sì.
Questo però
Però è
dove...
stata curata bene in realtà,
Sì,
con tutti i macchinari.
ma non
sì.
è un problema del muscolo, è un
No,
problema del perone.
tendine. Ah, ok.
Guarda. Spingi fuori. Ok. Vai. 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 Qui un po' di meno. Vai. Qui sei fortissima. Vai. Qui un po' di meno. Poco, non è tanto però.
Ok.
Rilassa. Ok. Buono? Qui va bene. Mano qua.
Ok.
Rilassata. Lascia, lascia, lascia. Ole.
Wow.
Attentiamo. Che adesso mi fa Pilates. Reformer.
No, stasera palestra normale, faccio tipo CrossFit, un po' più leggero,
Senza pesi.
con i pesi.
Con i pesi. E allora è leggero come?
Che non è CrossFit, è proprio circuito dove giro a spostare i pesi. Cioè,
Dove te la vedi?
Monti di Burtini.
Hai fastidio qua?
No.
Qua?
No,
Qua?
un po'.
Qua?
No.
No, è questo quello che ti dà noia. Un bel respiro. Fuori. Scusami, ok. Abbasso poco poco. Ok. Ok. Sdraiata sul fianco destro. One, two, three. Andiamo avanti. L'importante non è quanto, ma è dove e in che modo. Nel senso,
Io faccio una cosa molto sbagliata, penso.
lo fai da sola.
No, sì, ma mi chiudo. Cioè, siccome sto sempre con la schiena arcata, basta che io chiudo la schiena così
E scrocchi da
subito,
solo.
Lo faccio sempre.
A noi però interessa che scrocchi qua,
Ok.
perché questo è quello che ti toglie la tensione
Ok.
qua, capito? Quindi io vengo a prendere un contatto preciso e ecco. Adesso morbida. Ecco, ok? È molto importante contatto e direzione, perché se, io posso insegnare una scimmia come si scrocchia una schiena, però come si corregge una disfunzione è un altro paio di maniche. Torna a pancia in giù un attimo, vediamo se hai ripreso la forza. Spingi in su. Sì, non c'è il minimo dubbio. Hai fastidio qua?
Ma un pochino.
Ok, e avevi fastidio qua.
No.
Ok, quando rimane un po' di quel fastidio là, la facciamo vedere. Stendi il braccio, spingi in su, forte, spalanca la bocca, spingi in su, spingi in su, stringi i denti, spingi in su. C'è una piccola differenza, ma ecco qui è quando noi diciamo che il test muscolare deve essere un'arte, non una scienza, perché devi avere la percezione di quello che sta succedendo. Fastidioso.
Ok.
Vai. Il muscolo è qua. Chiudi vedi che non c'è spazio? Ok, spalanca tutto. Eccolo qua. Perché questo muscolo qua genera tensione e manda in disfunzione l'altra vertebra. Scusami Damiana. Apri, apri, apri. Apri tutto. 3, 2, 1, olè. Ti chiedo scusa.
Ok.
Vediamo, ci riproviamo per la terza volta. Faccio canestro o no?
No.
Ok, mani così, bravissima. Il tuo gomito, spingilo rapidamente indietro. Guarda, guarda me, così. Tac, un colpo secco.
Ok.
Ti do io il via. Vai. Olè. Vai. Doppio. Cammina un po', mi dici come ti senti.
Bene.
Meglio di prima? Peggio di prima, uguale a prima?
No. Bene, cioè tipo più leggera.
Ottimo. Lo consiglieresti?
Sì, assolutamente.
Bene, magnifico. Domande, dubbi, curiosità?
Mi controlli questo braccio?
Che cos'ha questo braccio?
Tendinite? Epicondilite? No, a me fa male qua.
Ah, epitrocleite, ok. Perché più condivide di qua, stavo andando a controllare.
Ok, malissimo là.
Da qua, spingi il braccio in giù. Male.
Tira qua. Ah,
Eh,
lo vuoi sapere perché?
eh,
Il telefono, che sto così
tanto tempo, tutto il
tutto il
giorno.
giorno, 12 ore al giorno, così. E quindi mi tira qui e mi fa malissimo qui.
Mi ci vorrà un po', questa tecnica si chiama nerve flossing. Non è piacevolissimo. Mi fermo? Vabbè, dimmi tu.
No, vai.
Aspetta.
Ah.
Qua anche?
Mhm.
Tutto.
Sì,
Qui ci vorrà qualche seduta, eh?
ok.
Faccio tornare.
Però non posso smettere di usare il telefono.
Ci lavori, mi hai detto, no?
Sì.
No, proprio in virtù del fatto che non puoi smettere, dovrò vederti un po' più spesso.
Ma c'è qualcosa che posso fare da sola? Cioè,
Sì.
perché dà sollievo massaggiarlo.
Sì, allora, così e pieghi la testa di qua col gomito sempre dritto e poi di là e fai questo.
Ah,
Poi torni qua
questo ok, l'altro no.
e poi... lo so, perché ti sto accorciando e allungando il
Sì.
nervo, ok? Non il nervo, ma diciamo sto mettendo e togliendo tensione.
Tira tutto.
Ok, ma tu scusami, fastidio?
No,
Qua?
no.
Quindi nel cavo ascellare non c'è compressione.
Non è proprio la posizione del telefono. Per
Morbida?
questo dico mi fa male pure il pollice.
No, gomito. No, non
Non
è
è il
articolare, è
gomito,
proprio
è-
muscolo e nervo, sì.
È perché questa è la posizione. Usando questo dito faccio questo tutto il giorno e sta tutto in tensione sempre.
Il polso qua l'abbiamo sistemato. No, a livello no, è muscolare, ci devo lavorare un pochino.
Ok, quindi si può sciogliere, però il
Sì,
problema
sì,
c'è.
Il problema c'è, il problema c'è.
Qui
Sì,
no.
We saw her before previously for some shoulder tightness and shoulder tension, but something new came up and I figured it would be worth showing. So, what'd you do? What happened?
I was stretching and I heard this pop and crack in my like hamstring area, and my the pull, the tension just went loose and I fell over and I was like, what's this thing?
So this just happened today, yes?
Yeah, and then I called him and I was like, hey, I think I broke my leg.
So let's have you point to even where you felt it. So
It was,
while
like,
doing
right
yoga
here.
and right on the back of the hamstring, but you felt a pop.
Yeah.
So what I told her previously was that when we hear a pop, it's usually not actually a muscle, it's coming from the joint somewhere. So that muscle, the hamstring, attaches up at the hip bone and down at the knee. So I'm thinking it was one of those two things, but we're gonna do an assessment so we can figure out what's going on with that, where it's coming from. But we're gonna start actually with just some light motion first, because I wanna see how you're moving now after that. Just reach forward first. So pain with that on the
A
hamstring.
little bit, but not
Okay.
much.
Okay, and then how about just leaning backwards? So we're looking.
Yeah, right here, but it's not. It's really deep in there, you know.
Okay. So right here, for your nerds out there, what we're doing is we're moving through the pelvis. Seeing how the pelvis moves when she leaned forward is actually where we see most of that abnormal movement come in. But let's see a side bend to each side now. So sliding your hand down your leg, good, and then to the other side. Does that agitate it to either
No.
side there? Okay, good. Let's have you lie on your back, please. So face up. So before we look at her spine. We're doing things different today because of what she's specifically done to the leg. And I just want to feel that normal motion first of that knee, and then also some of the motion of the hip as well, internal and external rotation of that femur, we call it. I'm thinking just from kind of seeing her move a little bit, to me it's looking like it's coming from more of this. And I'm actually going to palpate here the trochanter. Yeah.
Yeah.
Tenderness right there. Yeah, me too. So, and more so right in the middle, right there. So more than on the front, and more than on the back end of that, right there.
Yeah.
So I'm palpating the greater trochanter for anyone that's nerdy out there watching this. So now we're gonna.
Yes.
So internal and external, and that even more so,
Yeah.
is not moving. So feeling for internal and external rotation of the hip, that's where it really gets stuck, or that's where it really doesn't want to move. So just from that, in my mind, I'm definitely thinking more so it's coming from that hip, and then we're gonna feel that front to back glide of the knee. That feels fine, and then a side to side too. So anytime we hear something, if it is a pop, I'm just checking worst case scenario, structure of her knee for that structural integrity, making sure you didn't pop any kind of ligament or have any kind of tear in the knee. You have not. Yeah, and this should not feel painful at all to you. Definitely from feeling motion and just from doing a couple slight things, it is that hip. So that pop, even though you didn't feel like it was coming from your hip, it was. So let's have you go face down, please. So turn over, and we're gonna do some analysis more with the pelvis on the SI joint, so the sacroiliac joints. So looking at the leg length, we're way off there, Natasha. You're really bad. Your right leg is significantly shorter than the left.
Wasn't it the other way around?
Yeah.
What's happening?
So probably just something that she did to her pelvis when she was doing yoga. And yeah, that,
I feel that.
Immediately, me too. Yeah. And on that, so more on the right side, yeah. And that right one was the one that was way short. And even though on the front end it was the left hip, you feel how sore it is back here on the right. So the problem is not always even where we perceive we feel something. It can be something connected or something close. And then I want to muscle test the hamstrings also. The hamstrings neurologically are controlled through here, the lower lumbar. So from talking to our nerds out there watching the video, so let's test again the one that you didn't feel anything to. So that, and I want you to kick toward your head like that, okay? Go ahead. Okay, and I'm giving good resistance there, and you've got good strength. Natasha, you feel how that feels good. Now one more time with this, push toward your head. And not as good. It's not horrible though. That's not even really that worst one. We're gonna do a couple more, because I'm thinking more so just that pelvis is where we really need to address. So I would expect with feeling your pelvis and seeing the leg length here that her glute muscles are really disengaged more than anything. So let's have you hold this out here. I'm gonna push in, don't let me, and nothing there. So exactly what we're feeling is. And you feel, Natasha, did that feel weak to you?
Yes, super weak.
Okay, and we'll check the other side for reference. Hold there. So much better. I can't move it. Now let's check the other glute, the glute max, the big mover here. I'm gonna push the leg down, don't let me. Okay, not horrible. Let's check this one. Same thing, hold here, don't let me push it down. I said don't. I know. Feel it's harder, right?
Yeah.
So we're gonna make an adjustment to that right hip first there. So let's have you on your side with that right side up, and then I'm gonna bend the top leg. There you go. You know the drill. And I'm gonna roll your whole body toward me, soften there, soften. Good. And then let's have you go face down one more time. We're gonna retest a couple things and we're gonna see if that feels different to you also. So first thing that we looked at, and even how she laid on the table was different. It's straighter, which is good. And then leg length there, we're back to even. That was a huge change. Yeah, and that's not poking out so much, and that probably feels different. How does it feel compared to where it did?
Less tender and there's no pain.
Good, that's what we want. So then as we retest these muscles here with the nerves from the pelvis control, we should see better activation. So on that right side was where we were finding the weak ones. So hold here, Natasha. I'm gonna push in, don't let me. Hold. Okay, there. One more time, hold. There, good. That's what we want. Kind of bring this up. I'm gonna push down, don't let me. Good. And then let's check the hamstring on this opposite side even. So kick toward your head. Hey, I like it. Better. So seeing those muscles turn back on, that's good. So before we even do anything else there, I want to have you stand, and I want you to just, we're going to run through that motion again and see if that feels different even. So now, again, just reaching forward.
Yeah. I feel like pain here though.
So on the hamstring still.
Yeah, but that's probably a muscle, right?
Yeah, so muscle attaches to bone, and we went to that origin of where the hamstring starts. So we're still going to evaluate, but one more time with the extension also. So with back, so you move better.
Yeah.
Through both
Mobility,
of those.
yeah,
Yes.
range.
So that's first thing, but now I am gonna actually feel that muscle where you're feeling it. So let's have you lie face down for me one more time. So I'm gonna palpate that muscle from origin to insertion, and really that center point is where I'm gonna start, where she's feeling it. And where, so point one more time for me,
It's
where
like
you're.
right here, or
Okay.
like here, like kind of on this side of the muscle. Do you know what I mean?
Okay. So there's a couple divisions of that muscle, and I'm feeling right in that centerpiece of where she's pointing to, so I can see, yeah, and I feel some ropiness right through there. I want to feel that other one for reference. Nothing there. And that right there. And as we trace that, that's actually worse as I go up.
That's exactly like.
Yeah, right there. So that right there. Yeah. So this is a classic, what we call like just a sprain strain injury. So something where a sprain refers to more of the passive, so the joint being injured. And Natasha, what that means is that actually that hip bone itself, where we were, that where we adjusted. But then the strain refers to the muscle. So you actually, that hamstring muscle, you did strain. And right there, as we move up to where it inserts right on their sit bone. So we're gonna be right up where it inserts. And it's worse as I move up. I don't know if you feel that.
Yeah.
Yeah. So that's probably the most tender point of all.
Yeah.
Right there, I'm gonna put pressure on it, and I'm gonna move toward that insertion as I shorten the muscle, and then I'm just gonna lengthen it out like that. And then as we have her move again through this after, should feel better. There we go. Okay, good. Let's have you stand for me one more time, and we're gonna do that same motion that we went through as we have you forward.
Oh, it feels like so much looser.
Good, yeah. So now that's where addressing both bone and muscle comes into play. Now we've done that. We're gonna adjust the rest of your spine now.
Okay.
So let's have you go face down for me one more time, please. So feeling for motion of her spine. We've been working together for a while now, so knowing where her spots are that we've been working on, but still every time things are adapting and changing, so it's different. Right there between your shoulder blades. Big breath in for me, please. Let it all go. Little push there. There. Good. You all knotted up that was too.
Yeah.
I didn't want to move with just a little bit of pressure, so the more that second time. And good, just breathe through here. I want you to expand your ribs as you breathe, and we're just gonna let that area move. Good. It should feel easier to move. Yeah, that's what we want. And then we're gonna feel, and this is usually the hot spot for you, is right around that neck area there. Yeah, and right there.
I feel that.
Yeah. So with this, we're gonna do it a little different this time. Let's have you turn over onto your back. So with the left hand, I'll have you grab the back of your neck on that same side. Good. And I'm actually gonna be on that side. And then with this hand, we'll keep it right here. I'm gonna put my hand right over yours.
Okay.
And we're gonna be on the upper ribs here. Big breath in for me, please. Good, let it all go. Yeah, it is stuck, so we're feeling those ribs glide. We're gonna have you do this one here, and then all the hair. Okay, I'm gonna put my hands right over yours.
Okay.
And then there, squeeze your elbows together, and I'm gonna lean you back. Look up for me. There we go. Good. So good, that's the movement we wanted. And with that, for people watching out there, I'm actually vectoring that here with my sternum, right along her spine to get that right angle. So it's not just looking for a noise, but really wanting that specific spot to move. So let's have you go face down one more time. I mean, to feel the upper back. Yeah, so much better there. So we're gonna use this. It's just a instrument that we're using to adjust your neck. With some people, I always like a cracking or a popping or a twisting. What was your experience? You were one that you prefer something else?
I like it, but I also was like, I don't know. It's kind of this. I like this though.
She likes this. So with the first thing I'm going to do is palpate the muscles along the sides of the neck. And let's have you look down for me, please. And that helps them stand out more. And on the right side, all the way up the neck, that muscle's really ropey. And I'm going to move you here this way, and we'll show the camera right up close on the neck here. And what I'm feeling for along the neck is just these muscles along the side and right here on the right side. You feel that, Natasha?
Yeah.
How does it feel to you? And
It feels like almost, I don't know, like a bruise. Like it's hurt. It's like tension and like a sore muscle.
There's a lot of tension there, yeah. So with you, it's been a couple different things that we've been working on in the neck, but the main one has been that top bone. It's called the atlas, and that right side there, where my hand is. So at the top. And this bone I'm about to make an adjustment to so many times is a source of jaw problems, jaw tension.
Oh yeah, I have a clicking jaw. Does that have to do something?
There we go.
Like my mom told me to ask you.
Well, good thing I mentioned it.
Yes.
And you can tell your mom that you had asked me now too.
Okay.
So we'll look at the jaw too here afterward. Let's actually see the jaw open first and then close. I can feel it click too. So it's your problem is your jaw's too mobile actually on that right side. So it means more homework.
Okay.
We got exercises to do to create stability. If it's too mobile, if you've seen our other videos, we don't adjust it. We stabilize it through exercise. If it's stuck and not moving, then we'll move it. But a lot of this for you is the neck. When we stabilize your neck, your jaw tension is gonna minimize or go away. And there on the right side. So this is really specific on this bone. We know how it's moved, and I gotta get that angle right. Here we go. And what does that feel like for the people watching?
Feels like a spring, just like a spring on you.
Just hitting you, right?
Yeah.
And describe the difference for me now. I'm laughing over here a little bit because I can feel the difference.
Yeah. Like,
let's let you talk.
No, there's literally like a rubber band that doesn't have tension anymore.
The tension's gone, yes,
Feels
completely.
good.
So let's have you look down one more time, and I'm just gonna refeel the muscles. And as I move my hand back and forth, there's no tight muscles at all in the neck. So again, a muscle pulls tight for a couple reasons to try to splint or guard a joint that has a problem with it, which is going on there, and also to help try to pull the bone back into the right position. So when we do that, when we correct one of these joints, the muscles calm down. So, but sometimes, like we saw,
You're feeling tight and having some pain there, especially during my workouts, and some knee tightness and a lot of swelling in that knee. So
Yes.
just kind of left-sided.
How are we doing?
Way better.
Way better. Good.
So much better, yeah. I'm able to work out now, do the workouts I wanted to do and finish them completely without pain. I'm able to go heavier, so that's been amazing. The knee hasn't swelled up, the shoulder hasn't hurt, the hips been perfect. So
I love it.
yeah.
And then I would assume that translates even at work, maybe just a little more comfortable being on your feet with how long you are.
Yeah, I've noticed at work, after the 12, 13-hour shifts, I would come home tired, which is to be expected, but a lot of back pain, and I just related it to keeping the stress in the back and stuff, but it's really things that accumulate, so me not being aligned properly contributes to that. So it wasn't normal, but I was thinking it was. So I just feel lighter. So
How many people can relate
yeah.
to that? For sure. Cool. And then we haven't done an updated posture picture. So that's another thing we always do with all our patients. The very first day, we do a posture picture to see where we're at, and we do that again down the line, roughly a month out each time, to see how it's corrected. But without further ado, let's have you go face down and let's check in on everything, okay?
Alrighty.
Cool. So checking in with the hips, left side versus right side. And it's the right side we've been adjusting. That's another cool thing to mention, because it's a lot of left things going on for you, right? And sometimes, absolutely, yes, it's where we feel it. But sometimes with the hip, there's really not a left or right side yet. Sure there is, but functionally, the hips are the hips. Okay, so if we change the right side, we're changing the left side. So we've been adjusting the right side, and the reason for that is because that's the side not moving so much, and the left side is moving extra, thereby causing too much motion, thereby causing pain. So we'll be adjusting her right hip today. So we'll have you lay on your left side facing me this way, please. Cool, and then just a little shuffle toward me. Good. I'm gonna bend the leg here. I'm gonna put that arm on that elbow. Cool. Good. And then back to face down, please. Good. Did Siri just say that adjustment was good?
Yeah.
Yo! Cool. So a bit of mid back here. Right there. And go ahead and let your arms kind of glide forward a bit more. Yeah, there you go. Nice breath in. And out. Let that go. And then go ahead and flip over on your back when you're ready, face up. How was that? That was a big one.
Yeah.
Man,
That
we're
was.
saving that for YouTube. I like it. Cool. And then we'll have your body kind of come over this way just a little bit. Good. Straighten you up on the table just a bit. We'll be doing a neck adjustment here though. Checking in with the neck. Cool. Checking for motion here. Alright, so one right there. Good. Let that head relax like it's laying on a pillow. Breathing in and out. Good. Okay. Checking back in here. Last one here. And this, guys, for anyone who cares, because some of you guys are paying attention to what segments we're adjusting. This is C2, the second vertebrae down in the neck. Good. First one was me, second one was her. Good. Cool, so let's go ahead and have you stand up. Or actually, we'll have you sit. I want to double check in on that shoulder. So I'll have you sit. You'll be facing off to the right, facing that way. Let me check in with the shoulder here. So when it comes to the shoulder, it's such a complex joint. There's so many things to check, not just here. The shoulder is connected by way of the collarbone. So we'll always check the collarbone. Something popping up as a shoulder might actually be a collarbone. And also, you guys know the shoulder blade is connected to the shoulder, and it's where the shoulder actually sits in the shoulder blade. Okay, so the shoulder blade's not having a easy enough time gliding across the ribs here. Sometimes by adjusting this, we'll free up the shoulder. And that's pretty much what we've been doing for Yvonne most of the time, is a lot of this rib work here, because there's some tension here too, tight muscles. So we'll have you just rotate your body to the right a bit, and then we'll grab out this guy, the activator, and we'll be running up the heads of the ribs, helping all those ribs glide around. So here we go. Good, and back to center. Doesn't feel like that's maybe doing a whole lot, but do you feel that doing something?
Yeah, it feels good towards up top.
Good, good. And then we're good there. We'll have your left hand rest on this right shoulder. I'm gonna be sitting right here. So same idea here, the ribs, we're just helping them glide around from a different angle. Those same ribs, not always everyone's favorite adjustment. So just a couple here. Good, you do good with it though. Oh, you are a little ticklish. Uh-oh, 2 more. Last one, good. Good. Stand up, move around a little bit, and then let's take that new posture picture. Cool? Cool. So we'll have you stand over here. You'll be facing that way. I'm gonna sneak by you real quick. And then we will take the picture here. So from the front, just lining that up. Not making your posture better or worse, whatever feels natural to you. Yep. Cool. And turn your whole body to the left for me, please. Perfect. So hips, knees, and ankles, guys. We're looking for a straight line from our ear, shoulder, hips, knees, and ankles. The further forward we are, that's going to cause a lot of tension on the back. And if we go forward and then come back, it's usually those points that we're feeling so much compression. So a lot of people here at the hips will feel it. For you, we're looking nice and straight. Green is ideal. Red is tracing you. Okay. So here's the cool part. It's like, hey, was that better or worse than the first time? Who knows? Well, I know because I still got it from the first time. So you came in January 5th. Today is February 11th. January 5th, February 11th. So 5 weeks. We're going to throw those into a side-by-side comparison.
Oh, that's cool.
It's cool, right? Cool. So we can see from the first, oh man, check that out. From the first time you came in, okay, all your problems were on the left. Your left shoulder was higher, and you were leaning away from the hip and knee because it wouldn't make sense to put weight into where you're hurting. So you're leaning away from the pain, as most people do. And you could see that because your head was literally on that side of center. Check that out today. Wow. Huge, huge difference in 5 weeks. But you used to have daily headaches on the reg, and you've had none to few?
Yeah.
Huge
Improvement.
5 weeks later,
Yeah.
and we still got changes to make.
Yeah.
Because hypothetically, like, walk away from this and be like, well, I'm fixed, like, I'm good. True, but if we just like never saw you again, this would be something that creeps back. So I'm still recommending to see Yvonne, but now we're at such a less frequency than what we were. Now we're transitioning towards this maintenance where she comes in every once in a while, not because she's in pain, because she's feeling good. And
We're here today with Stacy, and Stacy has got a laundry list full of stuff. So what's going on, Stacy?
Literally a whole page. I had a lot of injuries as a kid, and then growing up as an athlete, dislocated a lot of my major joints, car accident, and surgeries on my knee and foot. So not really maintaining proper care over time, and also being from a small town, not really having any proper posture monitoring, just kind of accumulated a lot of different injuries.
And we talked about in sports too, right? A lot of times is the shake it off mentality. I think that gets so many of us in trouble. So we did a full assessment off camera here. I'm going to show the highlights here and the adjustments as we get going. So one thing we mentioned was hypermobile or too mobile in some of the joints, right? And it's showing up on motion. So I'll have you real quick too, just so the camera can see. Looking down all the way as far as you can. Good, and then up all the way as high as you can. Yeah, so there's where we really see that hypermobility, and that nose gets all the way flat with the floor, and then same with the ear to shoulder, good to both sides, and that same thing. So seeing that, that's too mobile in my mind. So most of the time it'll be too mobile through the mid neck, but something stuck either in the upper back or at the very top of the neck, and that's exactly what we found with you through our full assessment. But motion's one of the tools, posture another that we looked at today, and then muscle tests also. So we're going to show some muscle tests down low. We'll start with the low back and work our way up. So let's have you start face down for these. And you've seen other chiropractors and just recently too, right?
Yes, frequently. I've seen it a lot.
Yeah, and this is another common thing that we find, but it's not always maybe the right spots, or maybe it's not the specific thing for us. So many times we'll see people that have been to other doctors, other chiropractors, PTs. You've been to the PT, yes?
Yep.
Okay.
A few different ones.
Okay, so we're...
Yeah, they don't dig deep enough.
So there we go. Was this a little different than what you've had?
Yes, much more thorough
So far.
examination.
Okay, cool. So we're gonna look at the glute muscle test first. We'll start with the left side. Stacey, I'll have you hold here. I'm gonna push in, don't let me. Okay. With this one, I'm gonna push in, don't let me. So
I can't believe how difficult that is.
so that right when you feel it's not working at all, and for the people watching at home, I'm pushing the same strength on each side, but would you agree there's hardly anything in that right?
Yeah.
And this left one, I'm gonna push straight down, don't let me. Okay. And then, and not great there, we're gonna push straight down, don't let me. And nothing there. And that's, so the glute medius and glute max on the right side. Don't worry, we'll let you redeem yourself. And then feeling for motion here, we're seeing if the joint moves correctly, and if it doesn't, then over time it'll become painful. And that's right there, Stacey, with that right side. It's not moved. And I was showing her off camera here, it's the sacrum that's not moving, that's stuck, and that's what we're gonna get moving today. And then here in the mid back, right there, that one as well. And what I'm feeling for this muscle tension on the right side is really ropey even there. So that's something we want to see go away. And then at the very, very top, that's the atlas. And we found that right side of the atlas. And when we side bend the neck from side to side, when we're finding one's not moving as much, that's where I'm really looking at. So we'll start with the adjustments here, and then we'll re-show some of these muscle tests. Let's start you on your side, facing me this way, please. And I'm gonna bend that, there we go. She knows, it's like you've adjusted before. And you said last time was a couple weeks since you
Last week.
Oh, last week, okay.
Yeah.
So I'm gonna roll you toward me here. Good. I'm gonna pin your hips down and a little push there. A little more. There we go, good.
Got it.
And then let's have you go face down for me, please. I want to recheck those. Now's your chance to redeem yourself. So we're gonna start with that left again. Hold out here for me, please. So good, that left stronger too. I don't know if you feel that, even though you're on that right side. So hold here. Yeah.
Oh my gosh.
And then I'm gonna bend the knee. Let's bring that up. I'm gonna push down, don't let me. One more time, hold. A lot stronger. Not perfect, but a lot stronger. Would you agree?
Yes.
Move your out of the way here.
Yeah.
So right there. Big breath in for me, please. Good, and let it all go. Good, and that's really stuck, and we've got the ribs that are involved there too, right there. Where I'm pushing, that's the rib cage. So you're gonna feel your chest pop up from underneath you. And then just very lightly, you're gonna feel this drop. You okay with that? Okay. There, that's better. And then another rib right above it. And what I'm feeling for those, the ribs are getting stuck along that scapula, so that shoulder. If that shoulder is not moving or tracking correctly, many times, that'll be why. Right there.
The ribs.
The ribs, yeah. Go figure. But you had a car wreck, yes? And you didn't get any treatment after, correct?
Nothing.
Okay. So they have not healed correctly, so we got some work to do. Let's have you sit up for me, please. We're gonna do this next one seated.
Okay.
So this is the top bone in the neck. This is a spring-loaded instrument. I'll show you on your leg here so you can feel what it's like. It's going to be on your neck, on the top bone on the right side. So head down for me, please. Do you notice that? Where I'm touching?
It's really tight.
Yes, exactly. I wanted you to say it. Mostly on the right side, yeah? So you feel the difference more than the left. Now let's have you look straight ahead. And as we make an adjustment there. Good. And then head down one more time for me, please. What do you notice?
Looser.
Yeah. Does that feel
Wait, that was
too?
an adjustment?
Yes.
Oh, wow.
So we're so used to an adjustment being like a pop
Very
or
dramatic.
crack. Yeah. So you just experience that
Wow.
difference. Does it feel different when you move it too?
Mm-hmm.
So motion changes immediately, muscle tone changes immediately, the position of the bone changes immediately. That's when adjustment takes place. We're so used to seeing or hearing like a crack or a pop, but it doesn't have to be. Let's have you lie on your back for me, please. We're gonna check. So with the left knee, you had, it was an ACL and a meniscus.
ACL and meniscus twice. ACL was
Reconstruction.
fully replaced and
Yes.
meniscus was
So these are
reconstructed
major
twice.
surgeries on the left knee, fully replaced. And I want to show the highlights of a couple of the weak points here. So let's have the toes out toward me, and then I'm gonna push the leg down, don't let me. And that's, again, the patchy is how I would describe it.
Yeah.
It's like the strength is there, it's not, it's there, it's not. And we want it to be consistently able to hold, and it's not. And you had felt that, you told me before.
Yep.
Were you feeling that again still on that
Yeah.
inside part? So go ahead and relax that leg for me, please. And when I examine the full knee, I'm shortcutting it here on video, but we looked at everything structurally first. So when I pressed in all directions on your knee,
Yeah.
making sure the ligaments are still intact, they're strong, they're holding. So it's good to be adjusted, but even then, I'm not gonna hammer it. It's gonna be light, because again, an adjustment can happen either that quick, what you've seen before, or light.
Okay.
This is a light one.
Okay.
So
I've never had my knees adjusted, so this
well,
is
here we go.
interesting.
So this is a drop piece. You've had it, I think, on your pelvis you were describing to me. It's gonna pop up and then drop down like that.
Okay.
But it's for the knee, so let's have your knee here. And then right there. Is that all right?
Yeah.
Almost feels like
Doesn't
nothing,
feel like
right?
anything.
Yeah, exactly. That's what we want. A little more there. Okay. And that should feel different.
It's not as tender, actually.
That's what we want. You look confused.
I didn't know that was
Like,
possible.
wait. And then toes out toward me, please. And then same thing. I'm gonna push it down. You feel the difference.
Oh my gosh.
Yeah. So I can feel it. You can feel it. I'll let you describe it.
I seriously thought I was just going to be in that amount of pain forever because of how many surgeries I've had on that knee.
And at the end here, we'll have you walk on it too, which is
Okay.
really cool. Because when you stand on it, it's gonna feel completely different, more
Wow.
supported underneath you. But there's more to be done. And
Okay.
you've had multiple ankle injuries on both sides
ankles.
and a surgery on the right foot.
Yeah.
Correct?
So the hypermobile joints is, I think, the reason I roll my ankles so much. But then I had this joint here, the big toe joint, kept dislocating in my sleep where I'd wake up in the middle of the night and this toe was like pointed down.
Uh-huh.
So surgeons screwed these bones together, which I think now is hurting my ankle even more. But I haven't had as many issues there, but
So what happens when anything's glued together, either by choice from surgery or from the body, if it's degenerated enough, is it will become typically more painful over time. But in certain times, we want to do that to try to stabilize it more, like this, to stop dislocating. But because of that, when I was feeling your foot off camera, I mentioned here that little bit of swelling, and it's not moving as well on that right foot. So absolutely, I think that from this, it totally has affected the mobility of your ankle. So first motion, what sports did you play growing up?
volleyball, softball, track,
So
basketball,
volleyball and basketball were the
and gymnastics was the most injuries.
So there we go. And those three are huge for ankle rolls, little ankle sprains. A lot of times people say, well, I never had an injury because it wasn't formally diagnosed, or right, the coach would just say, shake it off, keep
Right,
playing.
right.
But it's still an injury, so and they add up. Yeah. You said it well, that accumulation of all the little things, and they add up. So here, that first one on the outside is the cuboid. I'm going to pull toward me here. There we go. And again, for not all of you, Stacy, you'll hear a noise, but we'll feel that joint move, and that's what happened a little bit here. There we go.
Wow.
And then the heel also. And that's what's really stuck, was that heel. Now I'm not going to be on that joint that was fused together. Obviously I'm not going to try to break apart a fusion.
Oh, good, thank you.
But we're going to free up all the neighboring joints around it that are taking more pressure or more stress. And with this, I'm going to use a light force technique also. And you haven't seen yet. How many tools does this guy have? This now, it's a little different than the one we used on your neck. It was like that.
Okay.
Super light.
Pretty crazy that I never did physical therapy on my foot.
I know.
After surgery.
I know, I'd say so too. And then the middle of the foot here, this is where, you know, it's these joints almost feel fused, Stacey, because they've
They're
been
so tight.
Yeah, they've just haven't moved so long. And then a little more on the heel. There we go. And this one should move a lot different. Yeah. So on that outside there. You're out different, it sounds even too. And that's the sign of a more healthy joint that sounds like that. And that too. And one more on top. Good. And then on the outside there. Okay. Good. And let's have you take a few steps so we're all through. I want you to feel the difference as you walk around, move a little bit, and see maybe how different that feels. What do you notice as you walk?
I don't feel anything in my knee, which is weird.
In a good way. How
I feel
long?
kind of like light, like floaty.
Good. How long has the knee been like that?
Oh my gosh.
That you've been feeling
Let's
it before?
see.
And we have a list. We literally have a list. I'm gonna peek at this list.
I want to say like 10 years.
So 2007 was the left
Longer,
knee
13
dislocation
years.
and the ACL. Yeah. So it's been years.
I'm trying to do a squat.
Yeah. And does that feel
I
different?
feel like, yes, I feel like so much stronger, and actually my glutes are like, I know I work out, I know I'm strong, but they're like,
They're online.
they're useful, yes.
That's because if we're using them and they're not working.
I don't feel that in my hips either when I squat.
Let someone do the work.
And why haven't you came in?
You know, I've been seeing you guys all over Instagram, and I've been wanting to come in, and it's just I just haven't had the time.
Wow.
I'm happy it worked out this way.
Okay, cool. All right, so we did some stem, we did some traction, some other things. Did they help at all, or was it just?
Yeah, definitely. Like I came in very stiff. I
Okay.
feel like it kind of like moved me up a little.
Okay, cool. So let's do a quick exam. We'll check you out. How about this way?
No.
How about this way?
A little.
A little bit? On the right or the left?
Discomfort.
Right or left?
Like right here.
Right there? All right, right there. All right, let's have you lean forward for me. Any pain?
No. No pain.
How about on the bring to the side?
No.
And this way?
No.
All right, stick one leg out for me. Any pain?
No.
Switch. Any pain?
No.
And cough for me. Any pain?
No.
No? All right. Let me let that
This
table
way?
down. Yeah. Anything we need to know about, Anna?
Not that I'm aware of.
All right, cool. Slide down for me just a little bit.
I don't know if I can do one finger, but I would say like just like
In this area?
between. Yeah.
Does this hurt when I press?
Oh no, but it feels good.
About right here.
Kind of. I would say like right under like the wingtip.
Right here?
Yeah.
Like in the lap?
Yeah.
Okay.
Definitely the lat area is a big one.
All right, cool.
And then here it's just like really like
In the trap?
I pull those muscles a lot.
Do
like
you
really,
exercise a lot?
Yeah, exercise, and I'm always really active.
Jesus. There we go. All right. So I want you to let me know if it's too much. That's good. All right, now we're gonna go into something called some grasping. Is that okay?
Like that. Yeah.
How we doing?
Good.
Great. This lat?
Yes, that one definitely. It's more painful.
That's good. All right. So we're gonna have this table move up and down. This is called flexion distraction, okay?
Okay.
Let me get this mic. Matter of fact, we'll leave it there. We'll leave it there. Let your arms drop for me. Slide up for me just a little bit.
There. And drop.
I'm gonna lift this table up and we'll let it drop 3 times, okay?
Okay.
Let me have you lay on your side.
Like this? Like this.
Bend this leg. Just relax.
Oh my god. Oh, that felt amazing. Same thing, like that?
Yeah. Let me have you bring this forward for me just a little bit. No, straight. Bring this right here. Bring this right here.
Oh, my hips.
There you go. Bend. Good. Hug yourself. Just relax. No, that's not that. Just relax.
Jeez. Clearly been a while.
All right, let's have you lay on your back.
Oh my god.
How we doing?
Great. Oh my goodness. I didn't even think my neck could crack like that.
How we doing?
Great. Definitely great. I've always been so scared to get my neck cracked.
So you never been adjusted before?
I've been adjusted, but I've been like, it terrifies me. So this is the first time I've actually been like comfortable enough to like let someone do the work.
What? Just relax. How we doing?
Good.
Sit on up. Swing your feet around.
This way?
Mm-hmm. Just relax. Good. Stand on up. How you feel?
Great.
Walk around, test it out.
Feels so good. My neck feels amazing. I don't think I felt relief in years in my neck.
Wow. And been waiting all this time.
Oh my goodness. Keep that core tight.
Ooh. It's making me feel sensational. Dropping weight here, losing calories. Honestly, I don't need to do any more cardio. This is cardio enough. This one here, I would say I feel it more in the glutes. So high, I felt it more in my quads. That was more so a full body or a full leg type of. This one is medium. So I feel this more in my glutes. It's giving my quads a break. And then let me go to low. Oh yeah, that shit is just. I don't really feel this one. This one's kind of like just waking me up, shaking me. Yeah, wobble, 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 wobble. Yeah. Back to high. So can I squat with this? Oh yeah? My quads are going crazy. My calves are shaking. Wow. No, not like that. Just one of these squats. Oh, wow. So if ever your calves feel super tight, you know. Oh, what? Yeah. Let me see, maybe like.
All right, guys. Today we have Karen.
Hi, everyone. How are you? Hold on. I'm sorry.
It's all good. Karen's waving at everyone. So, Karen, what's going on?
So I am feeling tension. I've been having a lot of tightness, I would say, in my muscles, in my shoulder. When I was doing the muscle, I believe the electrotherapy, I felt a lot of nerves being activated or awakened with the electrodes attached to me. So I do know my rear delts are feeling more so, they're feeling tight.
Are they activated or are they inactivated?
They're activated right now for sure. But while I do work out, I do feel.
You have rear delt problem?
I do have rear delt problems for sure. Yeah.
Okay.
My neck and my lower back, I do lift very heavily. I am a bodybuilder. I've also had kids, so my hips as well, and knees.
Knees?
Yes.
So everything?
Basically everything. Yeah, everything.
I'm a bodybuilder.
You're a bodybuilder?
No.
Yeah, you be. Oh.
Everywhere, right?
It's everywhere. I wouldn't say necessarily pain, but definitely
Where's it tight?
discomfort.
Where's it mainly tight?
Definitely the back. That needs to get, you know.
Right. So put your finger where the back is tight.
Lower back, but let's probably start with my shoulders.
Start with the shoulders.
My rear delts, this area, I do feel like it wants to get.
Okay, so we're gonna start with some grafting.
Right.
We're gonna do some scraping on these rear delts, okay?
That goes a long way. It's gonna last you forever.
Alright. Traps seem pretty tight too. You got a lot of tattoos, man. It's a butterfly?
This is a butterfly attached to an elephant, attached to some more crap.
Okay.
Yeah.
Butterfly, elephant, I see how they go together.
Right. The ear of the elephant.
Is the butterfly bigger than the elephant?
In real life?
Don't worry about it. Do not worry about it at all. Come on. You're not in love with this shirt, are you?
Actually I am.
Oh,
I just got it. Oh. Coached by Rocky.
Alright, let's move those arms around. Let's see how you feel. Any better?
Outside too.
Outside? Dang. All right.
Okay.
You a gangster? And a bodybuilder. All right. And have you been adjusted before?
I've been adjusted before, I want to say about 7 or so months ago in Chicago.
In Chicago?
Nothing like this.
Nothing like this?
No shade.
No shade.
Nothing like this.
All right, just relax for me. Any shoulder, you said shoulder issues, right?
Yeah.
So we're going to adjust your shoulder first, okay? Just relax. Let me see this arm. Just put your hand right there. There we go. Good. Bring it down. Just relax on me.
Oh, God damn. We used to do this as a kid too. I'm going to anticipate it.
Just relax, I got you. There we go.
We used to do this to our hands and our toes, fingers and toes.
Good. Sometimes people go to let their cousin do it and all kind of stuff. They're gonna have some problems. Let your head drop into my hand. Let it drop, let it drop.
Golly! Almost saw God. That felt great. I'm not gonna lie. Wow. You want to do the other side?
I got you.
Oh my God. Okay. Oh my goodness.
Let your head drop into my hand. Let it drop, let it drop, let it drop.
My neck is renewed. You know,
I don't know what it means. I don't know what it means.
My neck is renewed, y'all. Dang, that felt great.
Good. All right, have you lay on your back.
Okay.
On your back.
Right.
There you go. You getting it.
Dang.
Have you been this leg? Hug yourself. Straighten this leg out. Straight, straight. There you go. Just relax.
Oh my goodness. Oh.
Hug yourself.
What does this do? Does this straighten the back?
So what we're doing is we're mobilizing the joints.
Yeah.
In the spine. This ain't. We're doing now, mobilizing the joints in the spine.
Okay.
To relieve any pressure on the nerve.
Yeah.
The joints and stuff like that.
I do feel it relieving pressure on my lower spine. Oh my goodness. My erectors? And that's right in the middle?
The erectors are like right here.
Okay.
All over this area. So right now I'm gonna do, let me have you lift this leg up from me.
Which leg? This one?
Yep. I want you to lift it up without bending the knee.
Oh, without bending me. My bad. I'm about to kick you in the face.
All right, relax. This one. Right back down. This one. All right, good. That's what I'm gonna do. I have this table drop 3 times like that, okay?
Okay.
Just relax. 1, 2.
Right.
You could, yeah, just relax.
Oh, wow. That was definitely my ankles too. Oh, yep.
Right.
Mm-hmm.
Let me sit on up.
Thank you.
How do you feel?
I feel great. I definitely still feel like my lower back, my back itself is an issue. So as you said, it's tight. I know it's tight. So yes, I'll start foam rolling. But other than that, you cracked me. You definitely got my neck. You got my ankles, my shoulders. Shout out to the electrotherapy. I think I need to come back and do more of those for sure.
Let's have you stand up, walk around, see how you feel.
Oh, just walk around? Okay. Okay, walk around for real.
How does it feel?
No, I feel good. I feel really good.
Dancing move, right?
Don't please. No, I feel great.